Hey guys, Eric, your coach here. Hope everything is going well and you're having a great month. And so today we're going to move into our next topic, which is meeting number 18, exam typing. So even though this seems like this is about new patients and how to get them in your practice, and it seems like that should go first, I've just found that you've got to work through the problems before you can really find shortcuts. And this is really about creating flexibility and shortcuts and removing friction. I love this system. I first learned about this from some mentors of mine back in 2007 ish. And so I want to share this with you. I think this is a phenomenal system that's really going to help your practice get new patients in the door. All right. So, exam typing. Obviously, we got to create a system for it to maintain that level of success. We know that you got to know how to do a new patient exam to be an expert, but we've got to have the people skills to work the system and get people into the system so that we can be effective with it. So that's what we're going to talk about today. Here's an overview of what exam typing is. So how quickly are you able to get a comprehensive exam new patient in the schedule? Within 7 days? If you're going beyond 7 days, that's friction. And think about, where do you have the most open time where you could put new patients in. I stand in front of a group of dental professionals and I ask them. This happened in San Diego, and literally I remember because there were pillars in the middle of the room. The room was almost divided by these big poles. I had this side dental office, this side dental offices, and I said, raise your hand if you only see new patients on the doctor side, and this side over here. Literally the whole side raised their hand. And I said, okay, if you only see them on the hygiene side, raise your hand. And this side, they all raised their hand. It was the only way they would see new patients. They had been trained that way. And I said, which one works? And everybody laughed, of course. And when our system is too rigid, when we're so stuck to this, we have no flexibility, and we become a victim of our own friction. So we're going to talk about how to remove that. We're going to talk about using the law of the herd to have patients want to come in. And we're going to talk about exam typing, 1, 2, or 3, and we're going to create your system. You're going to do that. All right. So let's jump right in. So removing friction. Here's what we know. If you can create urgency, value, and commitment to scheduling and having the patient keep the new patient appointment on the phone call, you've won. That's the goal of all of this. So as you know, when I ask you what's the most important question to ask the new patient on the phone, I hear a lot of things, name and how they heard of us and all those things. But the real answer is what? What's the most important question to ask a new patient on the phone? When would you like to schedule your visit? Okay. And so when I'm doing that and getting there, I'm building that rapport, and I'm creating value, and I'm getting a commitment, I've got to be able to get that new patient in within 7 days. 7 days is an important number because we know that motivation only lasts 7 days. A lot of New Year's resolutions on January 1st start with a new gym membership. Gyms thrive upon New Year's resolutions. They initiate it, they get their new gym membership, and by January 8th, the gym is empty. 7 days later, the motivation to do something is gone. We've all been there. We've all tried something and said, it's not for me. But in the beginning, you were really fired up about it. Just like a new patient calls you, they may have overcome a lot of fears to call you. They found a lull in their busy schedule to call you, and they have time to get in now. And I'm not saying just have them come right down, but I'm saying, how close to that first contact can we get them in the doors? So in order to do that, you need to think about, where do you have the most open time in your schedule? So if you think about this, if you look at your schedules, well, our schedule's full. We're booked out a long ways. Well, when I go into practices, I look at them and I see, well, yeah, and we want to prevent cancellations and we want to have it locked in. But for right now, you've got openings tomorrow in hygiene. Yeah, but that's hygiene. We don't schedule new patients there. Why not? So we're going to talk about how to do that. Okay. So does your new patient system allow for flexibility? This is what I've been talking about. Can you make it work? And I'm going to teach you how to make exam typing work in your benefit. The law of the herd. Most patients, when you talk with them, they just don't want to be taken advantage of. And so if you can talk to them about how all of our patients get started with us this way. All of our patients in the same situation as you are in get started with us this way with our new patient visit. Come in, we'll meet you, and you'll have the same great experience they have also had. How do you feel about getting that scheduled? Law of the herd says when the majority of people are moving a direction, you're going to start moving that direction too. Okay, majority wins. So you need to figure out how to balance this, because we're too structured and we can't get people in. And I've seen practices make patients bend over backwards to get in the practice. In other words, they'll go, well, we don't take insurance. You have to prepay. It's a $280 new patient exam. You pay us that. We'll get you scheduled. It's a 2-hour visit with the doctor. And we're going to do all of these things: x-rays, photos, impressions, FaceBow, mounted models, exam, all of these things. The patient's going, whoa, I just want a cleaning, or whatever it might be. Okay. And so what we have to do is recognize that the other extreme is, just put them in the schedule. We'll figure it out. Emergency. I don't even count emergencies as new patients. I don't count kids as new patients. Many of you know this. I count comprehensive exams. So how can we balance those two things? Because, you schedule a healthy patient for a 2-hour new patient exam, you're going to have a lot of wasted time. You swing the other way and you just schedule someone for a 30-minute or an hour, and now you don't have enough time because a real problem comes in. They've got, their mouth is just a wreck, and you need all those things. So how do you create flexibility in that system? Well, by using everything that's listed here, you can actually balance that out. See, what you have to do is you have to be able to figure out what type of exam it is and schedule them for the appropriate time. But you can't do that on the phone, because they can't be honest with you and tell you exactly how much time they need, because you'll have a patient say, oh, I'm really healthy, I'm not having problems, I just need a cleaning. And they show up and they're a mess. And then you have someone who says, I'm really not sure. I've been to the dentist in 4 or 5 years, but I'm not having problems. So you give them all this time and they don't have any problems. They're just lucky. So what we need to do is get them in for an average, and then close if it's an easy case within that time frame, or give us an opportunity to have a second visit. And we were going to have a second visit anyway with the complicated cases, because we were going to have them back for case presentation anyway. So we think if the new patient exam process is A, B, C, D, all the way down to Z, we think we have to get all of that done in one visit. I don't know who said that, but we think we have to do that. And throw in a cleaning in there too, because the patient said they have to do that. Maybe we do, maybe we don't. But with really good verbal skills, following the law of the herd verbiage, you can schedule someone, not make any promises, just, hey, we're going to meet you, get to know you. You and the doctor will meet, figure out a plan on what's best for you, and we'll get you taken care of. We're going to reserve an hour of our time just for you. We're going to customize your experience when you're here and make sure that you're being treated exactly how you need to be treated based upon your health. How do you feel about getting that scheduled? Right? Now, that's creating flexibility. So let's look at how to do this. So, do you have a new patient system already? You probably do. Okay. Did you design it? Did it happen upon you? Did you go to a course and they taught you how to do a new patient exam, and that's the system you've been following, and only that one? There's a lot of systems out there that work. I've seen them all, right? And are you building trust in that process? That means being interested, not interesting. That means doing the emotional exam, finding their why. That means connecting with them on a personal level, not just a tooth level, and not wasting their time or your time. So in that, is your system flexible? The analogy I like to use, when I was a kid, we had these clear plastic, they're like pinball machines, but they were really cheap. And they had these little BBs in them, this real cheap spring in the bottom right corner. And you would pull the spring down, and the little BB would come over, and you'd let go, and it would shoot up, and then it would bounce all around, and then it would land in an amount. What was your score? Well, in your system, what you can have is all of these entry points coming down, but they all funnel to the $100 prize, right? They all funnel into complete comprehensive exam with case presentation. Boom, that's where they all end up. But they can come in lots of different ways. And that's the flexibility that we want to be able to funnel them down in the right spot, okay? So look, a new patient system that's designed for just your practice specifically, that builds trust, we know is going to improve case acceptance. You need verbal skills, but you need to be building trust with the verbal skills. That's going to help case acceptance. So We have a problem though. The problem is making sure that we can customize the patient experience to fit every single need of every single patient. Well, that means there's no one size that fits all, right? That creates a dilemma. We don't have one size fits all. And so wherever they drop in, we just start moving them towards that middle spot. The second problem we have is there it is, one size fits all, fits nobody. The second problem we have is a lot of times you don't fit enough time in, or you give too much time, which I was just talking about. So look, okay, we're going to give 2 hours to everybody. Well, you're going to end up with wasted time. You're not efficient, effective that way. We're wasting time. I don't want to do that. I don't want to waste time. So you're going to get frustrated with either not enough or too much, right? What does that mean? All right, come on, computer. Here we go. Well, come on, we can do it. You can know exactly what, if you can figure out a system that allows you to customize and fit an average, a good portion, that middle 60% of the people, not the bottom 20 or the top 20, right? But that middle 60, that's going to give you the best shot at getting that one size fits all, right? So we're going to work on exam typing. So look, it's a way to resolve the issue with making sure we don't have too much or too little time, okay? It's custom fit the exam to the patient. Well, how do you do that? Well, you can see the patient a lot of different ways before you start the exam, or you can decide, hey, we have this much time for this size of an exam, and then we'll finish later. We can talk. Well, I'll show you these. Okay. Now, sure, it'd be nice to schedule a new patient appointment for the exact amount of time. So maybe they come in for a hygiene cleaning, right, and then we schedule for exam. That's one way to do it. There's a meet and greet. There's just scheduling an average size exam and then going from there. We'll talk about all of these, okay? So when you have a type 1 patient, a healthy patient, now you can define this. I want you guys to write this down and figure this out for yourself. A type 1 healthy patient means they have all their teeth and you're not going to diagnose crowns. So it's fillings and maybe gum disease at the most, but no crowns, no missing teeth, nothing like that. That's type 1. That's the patient you could schedule and go, wow, we can see them, do the exam, and present and get them scheduled, financial arrangements, everything all at the same time. We'll do that in the hour we have, okay? Whether that's in hygiene or on doctor, okay? 2, exam type 2, the normal dental patient. This is somebody who has all their teeth, but probably have a crown or 2, maybe 3 crowns, scaling, root planing, fillings, those types of things. They haven't been to the dentist in 3 or 4 years, but there's nothing out of the ordinary for them, okay? And then type 3, that would be the complicated patient, okay? They've got missing teeth, and you got to do implants. They've got TMJ problems, full mouth restoration, something big. This is a patient you would normally have back for a consultation, a review of findings, that type of visit, okay? So if you can see them first before you schedule the exam, you could say, hey, they're a type 1, schedule them for 30 minutes with doctor, 30 minutes with assistant, 30 minutes with doctor, 330. Okay, type 2, it's 20 minutes assistant, 40 minutes doctor. Type 3, it's an hour with a doctor. Okay, whatever it might be. If you have the ability to do that, you can preheat yourself and get prepared, all right? So one thing I want to make sure that we're clear on here is we have a major issue that we have to overcome with patients, okay? This is really big. If you think about the dilemmas that we deal with in dentistry when it comes to building trust, think about this. The person who the patient is paying money to diagnose the problem, right? Pay me $200 to do the exam, is the same person they pay to fix the problems that they say that they found in your mouth. That'll be $4,000, please. Most professions don't do it that way. You decide what you want for dinner and you order it, right? The waiter doesn't come out and say, you want the most expensive thing on the menu. I always laugh. My wife says, what do you suggest? And they suggest something. I look at it, that's the most expensive thing on the menu. And that's what I would suggest too. So, the mechanic also has this sort of dilemma, because you go in for routine maintenance, your car's running fine, and they come out and tell you there's a big problem. Nowadays, they just take you out and show you, or they have their own intraoral camera version of that. So keep in mind, this dilemma that you have in building this trust is huge. So you have to make sure that when you're starting out with your patient, you have that emotional exam, that connection with them, no matter who starts with the patient. So any of these paths assume that they're all starting with a new patient preclinical conversation, your emotional SWOT, your emotional exam, okay, to find the why. So let's look at these. Here's your basic, hey, I'm going to schedule you for 60 minutes on the doctor side. Maybe it's 30 minutes of doctor time, but it's 20 minutes of assistant, 30 minutes of doctor, maybe 20 minutes of assistant at the other end. Okay, x-rays, some charting, full exam, and then treatment planning, coordination, and that sort of thing. Then they come back for a second visit for a consult if necessary. Maybe they're type 1 and we can present it all that day and it's done. Okay, let's look at another one. Maybe they just come in for x-rays. My assistant can do that anytime. So offices, they baffle me sometimes. They go, we can't get a new patient for 2 months. So when you dovetail your appointment, you don't have assistant time right there in that chair available with an assistant available. You mean to tell me you can't have someone come in, do an emotional exam, have her do x-rays, have her do charting, have her do intraoral photos, have the doctor come in and say, hi, diagnose the x-rays if you need to. Nice to meet you. Oh, you're an exam type 2. We're going to get you back as soon as possible. We're going to do exam and consult at the same time. Maybe visit 2 and 3 here are one visit. Maybe then you can match up exam, but I got that patient in right away to start with the x-rays. Okay? 6 x-rays billed, but we take a full series. Okay? If you don't know what that means, you better email me. Here's another example where we just flip-flop, we put the hygiene visit in front of something else. Exam and consult, separate consult. Perio's down there at the bottom, okay? So look, don't feel like you're stuck. It's really open. It's your flexibility. Here's a high fear patient, okay? There's an asterisk here, right? And it says diagnose the periodontal by your ADA typing. So don't just do the cleaning if a diagnosis hasn't been done properly. That means in all of these hygiene visits, it's assumed that you're doing a full mouth periodontal evaluation first, and then you're proceeding accordingly. In our office, the offices that I've worked in, the office that I recommend is even a person who has full-blown perio still needs their teeth cleaned. If you're good enough at verbal skills and good enough at the exam, you can separate the two and they can understand that, yeah, I'm getting my teeth cleaned, but I haven't addressed my periodontal disease. That's something totally different. The perception should be separate. So we would bill out a 1110I initial therapy. Then they would come back as soon as possible for perio. We would bill out, quadrants based upon how much they needed. And then some offices 30 days, some offices 6 weeks. They're back for periodontal maintenance, and then it never changes. Periodontal maintenance for life, 3 months or 4 months apart, sometimes 5, maybe 6. Okay, but this is assuming that you're doing a really good job at overhear psychology with a really good periodontal evaluation. 6 points measurements, 6 points bleeding, recession, furcations, mobility, all of it. Okay. If you don't know how to do that exam really well, or you want some pointers on it, feel free to reach out. We could talk about it. Now, this is just the high fear patient. They call me, I haven't been to the dentist in 20 years. I'm terrified. Can you come down right now and just meet us? We don't need to do anything. Just come down and talk. Come down, meet us in the office, see if you feel like this is a safe place for you. If you feel like it's a good match for you, then we can get you scheduled for an appointment. Come on down. I'm available to take care of patients. Maybe I have a treatment coordinator / assistant who's available. Take off the white coat syndrome, greet them by name, walk around the counter, shake their hand, take them to the consult room. Don't put them in an operatory. That's scary for them. Sit down with them, do your preclinical conversation. And those are typically the biggest cases that we get the most joy out of because we change someone's life. So of course we should roll out the red carpet for them. Do you have this path available in your practice? Okay. And then there's the start. I get offers all the time. We always start them in hygiene. It works. You can do that. As long as you start with preclinical conversation, right? X-rays, intraoral photo, periodontal evaluation. Maybe there's time for a prophy. Maybe there's not. You can see in this example, you can do a prophy that day and they're still going to move to perio if that's the case. 35% of your practice should be periodontal focused. That includes everybody. That means your new patients that come in should have a much higher rate of perio, probably 70% or more should be diagnosed with perio, unless you live in a very affluent area where fluoride for life has been a part of it, and every 6 months going to the dentist, all those sorts of things, okay? So what I would like for you to do is pause right now, spend some time. It's going to take a long time for you guys to sit down and come up with at least 3 different ways for patients to drop into your practice. Doctor, hygiene, one other, meet and greet, x-ray with assistant, whatever it is. Just a hygienist doing an exam. Just because they're a hygienist doesn't mean they have to do a cleaning. Guys, this really works, but you have to know how to work the system, okay? So push the pause button, come up with your own versions of this. It should take you about a half hour. All right, go for it. All right. I'd love to see the examples you've come up with. You're welcome to email them to me. I'd put on a big flip chart. I'd do them just like this, and I'd write them out. Now, you need to have a lead person for this, because what happens a lot is people come up with these systems and they just keep going back to default. Oh, we have something along. Probably should be an admin person and an assistant, treatment coordinator, who can put this system in place and make sure that we're working it. This is a huge, huge way to change your practice. Too many times we get stuck and rigid in our one way of doing things. We can't get out of our own way to be flexible, remove the friction, open our business up, and get more patients in. This isn't about accepting a bunch of insurance that's going to lower our fees. This isn't about sacrificing comprehensive exam. You still have to do a comprehensive exam here. You can see exam in every single one of these examples. That does not get bypassed. But you can do a cleaning before you do an exam. Can do that as long as you're doing it the right way, with periodontal evaluation, preclinical conversations, x-rays, intro photos, all of the above. And then you can have them back for the exam, and it could be a long exam with a consultation, it could be a short exam. You can just determine how it's going to be, and now you don't waste time. Our hygienists had the most flexibility. They had the hour or 2 hours open tomorrow where I could put a new patient in that called today. If I'm going to move a patient I scheduled out more than 7 days, I'm going to use the right verbiage to call them in and say, hey, I was telling Dr. Bobby about your visit here in 9 days. He did not want you to wait. He wanted me to call you right away and say he's willing to get you in our schedule tomorrow. And so we opened up some time tomorrow at 11 a.m. Could you make that work in your schedule and come in? You can do that and still get people in the schedule, okay? Flexibility is important. If we're too rigid, we get stuck. I have an office. They are determined to only see new patients in hygiene, okay? The hygienist is booked out really far. That makes it impossible to see new patients. Get them in with the assistant and have the doctor come in there. The only thing you're not doing is a cleaning. Not everybody's expecting to have a clean the first time. Use the law of the herd to tell them what you do offer on that first visit. And the second visit will be the cleaning and the consultation if need be. You can combine those things. Make it work. I need you to think in terms of less than 7 days. How can you get your new patients in? Otherwise, you're not going to grow. Patients are calling now. They don't want to wait. Get them in now, okay? So who's your lead person? Make sure you pause and identify that person. Now, your lead person is going to make sure we're seeing patients on a variety of ways, at least 3 different ways, okay? Let's look at this. Make sure we covered everything. How quickly can you schedule a comprehensive new patient exam? Less than 7 days? Where does your office have the most open time? Newer practices, a lot of times, will have more open time on the doctor's side. Utilize that time. That's going to allow you to remove friction by having 3 or 4 different ways patients can drop in, and talk up to the patient about how we get started with all of our patients in your same situation this way, okay? And then exam type them. When you see them in the chair, exam type, look in their mouth and say, "This is a type 1, 2, or 3. We all know what that means. And then we know how much time to schedule them for the comp exam based upon that viewing and that exam typing, okay? And you've created your new patient systems now. You're going to tweak it. You're going to have to work on it, but that's okay. All right. This is a fun meeting. It really opens your mind to some new possibilities and hopefully some growth with some large cases. That would be amazing. All right. Awesome job, you guys. It's a great meeting. I know you put a lot of work into it. I can't wait to see your different drop-in points for your new patients. I want to see those. So email them to me, ericyourcoach@charter.net. And then next month, meeting 19, we're going to take what we've been doing with DISC, customization, right, with patients, and we're going to talk about team building with it. How do you operate as a team, and are you healthy in your interactions? Okay. So do you know how each other likes to be treated, especially if it's stressful? Do you know how to appreciate each other? Okay. We'll talk about that exercise. And then we'll talk about how to have crucial conversations when things aren't going that well, and how to move towards forgiveness, because that's the only way to move forward as a really good team. And if you want great results, you got to be a great team. All right. Awesome, you guys. Thank you so much. Great job. You guys are doing so well. And I love hearing about everything you're going through right now. And so keep sending the messages, keep emailing me, and let's keep moving forward. All right. Take care.